Clinical leadership is viewed in different ways globally and comes down to an individual's perception. If we conducted a survey study of 100 people, I can almost guarantee that the answers we receive will be different. While each answer is different, the questions on the importance of clinical leadership does need to be asked. What would worldwide healthcare services look like if there was no clinical leadership? Would healthcare be able to continue to support the demands of patient care needs without clinical leadership? Would the current healthcare approaches be sustainable without clinical leadership there to guide the current workforce? Hi, my name is Murgolo, and within my presentation today, I'll be discussing my definition of clinical leadership, what is the most preferred leadership style to my relevant health field, and the attributes that influence and motivate clinicians to implement high-quality healthcare. However, before I begin, I would like to share with you a brief background to my profession and the health environment I currently work within, to allow for a better understanding and a reference point to the topics I'll be discussing with you today. I currently work within an aged care setting, working with patients who reside within the home having high levels of cognitive impairment. To provide context, aged care, similar to other health areas, have a variety of different types of health professionals, including registered nursing, personal care workers, and allied health. The Australian Institute of Health and Welfare highlight that the aged care sector continues to grow, where it is predicted that the current rates of dementia will double by 2050. It is important to note that aged care is a different health model to what you would see in a hospital setting, as aged care is a home in comparison to a location to receive treatment. Aged care patients provide a variety of challenges to health professionals, such as behaviours, falls risks, and increased need for incontinence support. But also worth acknowledging that each person's care is different, no matter the disease, requiring the health professional to continuously adapt on a day-to-day basis, something I'll cover later today within my presentation. So let's get started with an important but vital question. What is clinical leadership? As defined by Joseph and Huber, clinical leadership is the process of influencing point-of-care innovation and improvement in both organizational process and individual care practices to achieve quality and safety of care outcomes. While Ledlow et al. Believe leadership is required to fulfill the purpose of caring for others and improving the health status of the community or region, while continuing to raise that holding a leadership position means making a life or death situation. Both, in my view, very good definitions of clinical leadership. However, something to highlight to you as well, a tricky proposition. I mentioned earlier that clinical leadership is based on viewers' perception, with two distinctively but similar answers within two separate journals. As you can see within the PowerPoint presentation upon your screen, there are many perceptions of clinical leadership. To another example, a literature review by Stanley and Stanley highlights Harper's definition suggests that clinical leaders wield clinical expertise in specialist practice domains and uses interpersonal communication skills to support nurses and other healthcare providers to deliver high-quality care. But as you can see, the list is endless, where we could speak for hours on the different perceptions of what clinical leadership means to different people. I'm sure even yourself, you have your own verdict. To myself, clinical leadership resembles Gowd, who believes that leadership is all about leading people, encompassing the assuming responsibility, leading by example, and seeking as much best practice as possible for continuous improvement. Gowd also believes that clinical leadership requires the ability to work with professional colleagues across the organization while working on behalf of other clinicians and looking at ways to continuously improve. Drawing on my experience within the aged care sector, I believe a clinical leader is best defined as someone who leads by example, looks for various continuous improvement opportunities, while also empowering and uniting all health professional teams. As mentioned earlier, the clientele in aged care requires health professionals to adapt to change on a day-to-day basis, with a clinical leader's responsibility to support this through regular education, direction, and sustaining high morale of the team to continuously look at ways to improve the care delivery. A clinical leadership needs to support the team while also identifying gaps within the current system, with an objective to provide strategic outcomes or solutions to overcome these gaps. While the clinical leadership needs to provide a vision, if we look through an aged care lens, it is serving the best quality of life for whatever time frame the resident has left. But let's remember, health professionals are people helping people, with human error a factor in the day-to-day professional. We are only human after all. However, it is the clinical leadership's responsibility to support the team during this era, educate and provide solutions, and guide to ensure that lessons were learned from the era for continuous improvement. Which leads me to my next point. What is the preferred leadership style? I believe servant leadership is the most preferred model in an aged care setting. I'd like to provide an example to put things into context. Mrs. Smith moves into aged care following deterioration of her physical health. limiting her ability to stand and walk without falling. Over time, her cognitive impairment gets worse, where she begins to develop behaviors she did not have in the past. She returns to a time where she is 30, and at 3 p.m. every afternoon, she states that she requires to pick up the children from school. She gets up and slowly walks to every door, trying to find an exit route, increasing her falls risk and becoming verbally aggressive to anyone who comes to assist her. This change in health is common in aged care, increasing the demands and workload of the various health professionals. The example that you see is not the same every day, with various strategies required on a daily basis. While it is important, it is reminded that aged care is inevitably working in someone's home, reducing the resources that may be available in comparison to other health professionals. Sun et al. Raised that the Australian aged care system serves more than 16% of the population. And if you remember earlier in my presentation, it was suggested by the Australian Institute of Health and Welfare that rates of dementia will double by 2050. This is a cause for concern, however, as Kay et al. Highlight the current nursing shortage within the world, with many nurses faced with increased workload, which affects work engagement. With that in mind, let's talk servant leadership. Aged care professionals, as highlighted, need to adapt to change on a day-to-day basis to support the patients they care for. I believe servant leadership is a positive model approach for an aged care setting, as it allows leaders to lead by example in focusing on the needs of the staff. It also allows the leader to strive to serve others to get the best optimal performance by the staff, rather than take control. In a challenging environment, a staff member can find themselves with a low morale. However, a servant leadership approach, they would gain the support of the leader on what is required for that particular day. As you remember earlier, I mentioned Kay et al.'s reference to staff shortages globally. While servant leadership boosts work culture and environment, reducing staff turnover in an already difficult recruitment area. While servant leadership allows all health professional domains to have an equal importance. With my example of Mrs. Smith, it might be the lifestyle team who takes charge and supports all other health professionals by adopting validation therapy to the situation. Servant leadership will allow this to happen, with the leader supporting this approach to other teams for maximized success. Servant leadership is a compassionate approach, which is important in an aged care setting. Different to a hospital, many patients who live in aged care cannot go home, with staff becoming their second family. When a patient passes, this can cause distress or a low morale to the health professional field. Within aged care, many registered nurses are entrusted as the person in charge of the floor. However, as highlighted by Jack et al., many newly qualified nurses are underprepared for this clinical leadership need. Servant leadership will allow the clinical leader to support all registered nurses develop an emotional support framework, in turn accelerate learning opportunities to successfully distribute to staff and other patients following death. In this instant, the servant leadership would adopt an emotional need and support the staff and morale on handling the situation. This leads us to our final discussion point. What attributes of leadership influence and motivate clinicians to work towards optimizing and implementing high-quality healthcare? Marion et al. State effective communication, clinical competence, being a role model, and being supportive and approachable as key attributes in clinical leadership. I'd like you to picture yourself in this. How would you feel if you had a leader who did not talk to you, not provide any communication in your day-to-day role? Or what if you had a leader whose only communication skill was to demand orders on a daily basis? In the long run, I would feel low, tired, unmotivated, and to some extent, probably afraid, which restricts my continuous improvement within my role. By engaging and communicating to staff, by influencing the health professional to grow and want to improve. This point by Marion et al. Will also make the health professional feel valuable within the team and motivate them to conduct their best work. And in hindsight, each person is a different set of eyes and may have a solution that is valuable to the team. Further attributes of leadership that influence and motivate clinicians is shared by Marquise et al. As you can see within the PowerPoint presentation, Marquise et al. Highlighted the 10 leadership attributes identified by Kerr to leading, influencing, and motivating health professionals. Again, making reference to my definition earlier of leading by example, Kerr's 10 attributes highlight inspiring change, requiring vision, imagination, abstract thinking, articulation, aptitude to sell, understanding of the external environment, risk-taking, and confidence, while he's also accountable for the entire organization. All 10 attributes highlighted, in my opinion, influences and motivates health professionals as it leads by example and provides a sense of purpose to the surrounding team. Each attribute contributes to a patient's care and ensures that the team provides high quality service. It is also vital to note that if one attribute is not incorporated, there is a chance that the team's performance will be depleted. For example, Without a vision, will there be a common goal for the team to work towards? Or if the leader lacks understanding of the external environment, will the team still have a high morale to perform the task? A clinical leader is responsible for delivering care, and by conducting or 10 key attributes, they are able to successfully succeed influencing and motivating clinicians. In conclusion, clinical leadership is leading by example, with key attributes such as vision and inspiration for change. Within aged care, these attributes ensure that servant leadership styles work best, increasing the work performance of all health professionals within the sector. I'd like to thank you for your time in listening to my presentation today.